Good morning, everyone. First of all, I'd like to acknowledge the speakers before me, my fellow occupational health nurses. Some great content in what they've said. I want to change it around a wee bit. I don't want to repeat what everyone has said. I'm going to look at it from a point of view what benefits to the business and your employees get from having annual health assessments. So, as you can see, I'm the Health and Wellness Manager for Fletcher's Earthquake Recovery Division. I'm sure everyone in this room should know who we are, if you're all from Canterbury. We are a division of Fletcher Construction, so a lot of the work we do is based around what Fletcher Construction has. So just as a bit of a background for you, I came into the Fletcher EQR just post the February earthquake, and when they got the job there, they said there's going to be 200 workers. And they wanted me full-time, and I thought, yay, 200 workers full-time, I'm going to be doing nothing. And then within 6 months, we're at 700 employees. Now, our employees are essentially, as you're probably all aware, as quite a few are in this room at the moment, ex-employees and current. We are primarily office-based, so dust and noise for us isn't a major concern for our individual employees. However, we have thousands of contractors. So I work closely with the health and safety advisors, and they're a fantastic group of individuals who go out and promote all health and safety out to our contractors and ensure it's being done correctly. So I want to talk about the benefits and why we choose to do what we do for our over 700 based employees at EQR. So, as lots of people have said before, when was your last time you had saw this person? Okay, I tried to find some latest statistics, but they weren't out there. But roughly, most people, if you're like me, go to your GP just for if something's wrong. You don't go for your annual health checkup. When we first started doing our annual health assessments, we had a lot of our guys had come in from the construction business, our contract supervisors, and they said, I'm not having an annual health check. I go to my doctor to have my prostate checked and everything else. And we said, well, hang on a minute. Your GP is not an occupational physician. They're not specialists in their field. They do not do hearing and lung. Some do, but the majority of them don't. And I want to really emphasise the importance of, like the previous speakers have said, not using technicians, using occupational health nurses, because health assessments have changed for me since the earthquake. It's not just about sitting down and ticking a box. It's about getting to know your employees, and whether you have an in-house occupational health nurse or third-party provider. Occupational health nurses don't really change that much in Canterbury. We're a force of nurses who tend to stay in the business, so you will get to know your occupational health nurse. To me, it's a lot around effects of the earthquake for us. So people are coming and sitting in front of us and talking to us about things that are affecting their family. So yes, we're doing hearing, we're doing lung, we're doing everything else, but it's other things. We've had to become really sound knowledge on what's happening in Canterbury from a health perspective and offer advice and refer people through to appropriate agencies. So it's more than just that, and that's what I really want you guys to sort of see that. When the people that we had a problem getting into have the annual health check right at the beginning, we actually have it as part of the employment agreement, and everyone has a pre-employment medical. So we had to unfortunately do a tough line with some of our staff and go, in your employment agreement, you agreed to have an annual health check. Now, what we're finding now is some of our staff, as they're leaving, are going for job interviews, and they're coming back to me and saying, I'm not taking that job, Bridgette, because they don't do annual health monitoring. That's how much we've embedded and changed into the thinking of our employees. And as Fletcher EQR comes to an end, whenever that will be, I like to think that the knowledge that our employees have taken away from doing annual health check will go and be embedded in other businesses across Canterbury. So the changing face of Christchurch. So 1 in 8 are employed adults work in construction in Greater Christchurch. So that's a lot of us out there. So for us also at EQR, when we had to get 700 employees, a lot of our staff came overseas. So not much different from some of your companies in front of me here today. So a lot of our work has been with annual health checks is also advising them that, like England and Australia, they're on a reciprocal agreement with us for healthcare, but all those other countries aren't. They don't understand our health system. They don't understand ACC. We're in the ACC partnership program, so a lot of our health assessments is discussing that as well, how to get a GP. Emergency department at Christchurch Hospital was logged up with people going there for a common cold. That's not what ED's for. So it's talking to them, organising third-party providers so that they know certain GPs where they can go to, and they won't be charged international rates. They'll only be charged casual rates. So that's a key component of us. And for them, understanding our health and safety, understanding that PPE, is a requirement, health and safety monitoring, having that knowledge. So that's why a lot of our workforce is quite international, and we're quite mixed, our workforce actually. We have probably people from all those countries there. We've seen high component of Irish. If you've had anything to do with us, you know we have a lot of Irish. So a typical health assessment for us at Fletcher Construction, we have some mandatory things. We have hearing. Now you may say, why do hearing testing to office staff? Well, we've with a good baseline pre-employment, it gives us a starting point. So we had this office person in the last few years who came in, she had a pre-employment done, it showed a medical hearing loss. Okay, it's not a noise, it's a medical hearing loss. Came for an annual health check, and that was impacting on her hearing loss. She couldn't hear conversations in the office. She was missing things. So we supported her and showed her how to get some funding and got her through, and she's now wearing hearing aids. Her production's gone up in the office, her interaction with employees has gone up in the office, so it makes a difference. So that's another case scenario was we had a guy who was out on sites and he misunderstood a lot of things that people were saying. He seemed to think that people were talking, one conversation, he thought they were talking about actually a sexual content in a relationship, in somebody's relationship, and it wasn't that at all when he got into quite a bit of trouble. Did his hearing test, and he had significant noise-induced hearing loss that was eligible for ACC, met the ACC criteria. He now has hearing aids, and he said he can't believe how much of a conversation he was missing. So that's the added benefit. And it's just not like the other previous speakers have said, it's just not about doing the hearing test, it's about asking all the background, good questionnaire and asking the background questions around it. Lung function, all our employees get a lung function, and again, we use it for a great baseline. Way back when we started in the beginning, we've constantly changed our questionnaire, and we actually, as we notice more hazards coming through in the workplace. But spirometry lung function is more than just doing the test. It's about looking at smoking, how many workers have smoke, and doing programs around smoking cessation. We use all our health assessments. We use, as for toolbox talks, we identify learning needs, training needs. I go back to the health and safety team and they put out toolbox talks. And some of those toolbox talks are then generated out to our contractors. So we're looking for trends, we're looking for picking up where our education is needed. Vision, while I've been in the organisation with Fletcher EQR, we've had 3 cases where I've had to remove car keys off people because their driver licence say that they actually have to have drive with glasses. And they're not, and they're absolutely failed appallingly on their vision. When I worked for Safe and Sound Solutions, which is now called Oh Well with Ingrid, we had, I can remember on several occasions, there was companies we were going to and people were failing the vision test, and they were like truck drivers and people like that. So you're making a difference. The benefit is you're making a difference not only to your staff, but also to other people on the roads, and it's a whole safety issue. Fatigue questionnaire we brought in 2011, I think it was 2012, we identified because of what we were facing in Canterbury, fatigue was a big issue, so we actually brought a fatigue questionnaire in way back then, and it's been rolled out throughout Fletcher Construction, so we've been monitoring fatigue for a long time and doing a program around that. Musculoskeletal, You may think, why do musculoskeletal in a health assessment? It's a really great way of getting early reporting for discomfort, pain and injury, especially when you're with the ACC program. It's a training way to identify your training. It's amazing what you can find out when you do the musculoskeletal. So I find when you get through, you've done all these questions, you actually sidetracking. 45 minutes is very hard to get a health assessment done in 45 minutes, especially when your staff know you, especially when they're not going to their health professional. There's always other things they come and ask you. And honestly, you name it, I've been asked it. We've had international people who are pregnant and don't know how to go about going through a pregnancy. Some haven't known all that side of things. We've had sexual dysfunction. You name it, you get asked it because you're a nurse. Okay, so and if we can make a difference and support someone and refer them to the right place, that's a difference, I believe, is important. Cardiovascular screening, we do. It's not mandatory for our staff, but we do it, and there's probably no one that refuses it, to be honest with you. One of the big things with the cardiovascular is one of our hubs. I'm assuming we had quite a few hubs out there. They all turned it into a bit of competition. They'd get their cholesterol, their blood sugar, their weight, their BMI done, blood pressure, and they'd come out from the health assessment, watch the score. And it became a bit of a joke. They wrote it up on the whiteboard. And then they realised that actually over 80% of them actually had high cholesterol, high blood pressures, overweight, high weight, they've ticked all the wrong boxes. So they looked at what they were eating and they realised that for morning teas they were eating absolute rubbish. So they changed their morning teas that they brought in. They started walking at lunch times and they turned themselves around. Within 3 months, they had lost weight, they were eating healthier, and they were different. So to me, health assessment is actually just more than ticking the box. It's about making those changes and getting someone along to see their GP if they need further assessment. From there we look at our statistics. None of our information goes out to any other. I hold all our actual individual employee information, and we look at statistics and we plan a wellness program through those statistics. And that's what I believe the true benefit is. It impacts on a positive workplace culture if you do annual health checks. Okay, it makes you stand out alone from other businesses. You look at your vision and your values of your business and put them in, and you make employees as number one, along with health and safety. Great way to identify training needs. Recently we had a couple of incidences where a couple of our employees said they were exposed to mould and thought they had sore throats. We realised then that we needed to remind around the correct use of masks. So our wonderful health and safety advisors went out and did an education program on correct use of masks. So training needs is a great way to pick up what you need. You're a preferred employer, and I can't emphasise that enough. And I'm seeing that more and more as our employees are leaving and going out to the Greater Canterbury, they are checking you out. They're seeing what you offer. They're looking if you do annual health checks. Where you sit in health and safety, because it's become so embedded in them, that's what they're looking for when they come out. So if you want to be that preferred employee, look at what you've got on your website, look what you do in action, Just don't talk it, actually do it. Increased employee retention, people want to stay, it goes in hand with being a preferred employer. We have staff leave and they come back to me and they said, wow, we didn't realise how well we looked after and what people do for us. And the last one is, of course, increased production. If you have healthy and well staff who aren't tired, staff who can hear, staff who aren't struggling to breathe, whatever, you're going to have increased production and you're going to be a leader out there in the business. So, once again, thank you all for coming today. And I know this, like Donna said, we're probably talking to the converted here. But still, if you can make it change to one person, you're doing a great job out there. Thanks.